One of the most common questions that we're addressing today is about autonomic nervous system disorders, specifically postural orthostatic tachycardia syndrome, or POTS, and orthostatic hypotension. So what we're seeing with these conditions is that specifically with POTS, we're seeing mainly young female patients that are having things like migraine headaches, chronic pain syndromes, and problems with anxiety. Whereas the orthostatic hypotension patients tend to be some of our older patients that are having a lot of problems with dizziness, specifically when they're getting up from sitting to standing. We're not going to break down those disorders with much detail today because those are for some other videos that we have available and for other blog posts that we've written about. But we're going to go into why we choose to address these issues using our approach by addressing the cervical spine and the vestibular system. The cervical spine has a few main areas of interest when it comes to dysautonomia. So first, you have your C2 nerve roots, which are the nerves that come out of your C2 vertebrae. And mainly it's associated with the greater occipital nerve, but there are scientific studies, biological studies, that have shown that the nerve roots from C2 go into the brainstem and they have direct effect on the sympathetic nervous system regions in the brainstem. The other aspect is the atlas transverse process can affect the jugular foramen, which has the jugular vein, and the vagus nerve, which can also have a parasympathetic influence depending on what you're trying to go for. And we've seen it repeatedly even before doing a lot of our functional neurology, where we could actually see patients with POTS and with orthostatic hypotension that just by correcting that C1, C2 area, that people can have sometimes really dramatic effects on their autonomic nervous system disorder. So that's one of the big reasons that we address that area, is because there are some really important pieces of anatomy that can contribute towards the presentation of dysautonomia. The second aspect is using the vestibular system, and we use the vestibular system because there are really strong connections from the vestibular nerve into areas of the brainstem that mediate the sympathetic nervous system. So when we turn someone around in a chair, when we get them to do vestibular exercises, there's a good chance that that vestibular system is influencing those sympathetic nerves. And by influencing those sympathetic nerves, you might be able to address some of the aspects of dysautonomia through the vestibular system. The other reason that we look at the vestibular system is because there's a lot of people that may have sensory errors that involve the vestibular system. And by correcting these sensory errors, you could actually mediate the effects of the autonomic nervous system, because one of the things that happens is if your brain cannot perceive itself accurately in space, if it cannot perceive gravity accurately in space, then what it tends to do is it tends to have a hyperactive sympathetic nervous system response. So by reconciling that sensory error, by using some of these vestibular therapies, then we could actually help to calm down the autonomic nervous system and help address some of these disorders, simply for the fact that we're addressing the sensory error that is probably leading to this hyperactive sympathetic nervous system response. So that's our rationale for using the vestibular system and the cervical spine for addressing autonomic nervous system disorders. And while we don't help every single patient with dysautonomia, we have seen enough of a response from people, especially if they've had whiplash disorders or concussions, where this type of therapy can actually really improve the status of these autonomic nervous system disorders. We've been fortunate enough to work with enough cases now where people are coming in from different locations in order to assess whether we could address things from a functional neurological perspective, or if we can address it from an upper cervical chiropractic perspective. And sometimes it's the best of both worlds that can really help people get over this problem in as quick of a manner as possible.